Hello everyone to my channel. My name is Amr and I am one of the cardiology trainees in Bristol. These days we are in the season of application to medical training jobs, and I wanted to share with you very important tips on how to answer the behavioral questions in your interview, and I hope you will make use of this piece of information to reach the career of your choice. The behavioral questions are one of the very important questions in the medical interview. And in these questions, the interviewer aims to see how you use your skills to manage difficult situations that you can face during your work in the hospital. So there are many themes for the behavioral question. In this guide, I have 9 important tips to consider during answering your behavioral interview question. Point number 1, you have to understand the purpose of the behavioral question. The purpose may be conflict resolution, it can be managing difficult patient, it can be communication skills, working within a team. So it's really important to see what the interviewer is looking for from your answer. The second point, always try to use the STAR technique. And STAR stands for the situation, your task, your action, and the result. In the situation, you have to describe the context during which you faced the difficult situation. What was your role? What was patient like? The team, what was your team like? Number 2, the task. And in the task, you have to describe what the task that you were asked to do, what was the task you were asked to do, or what was your purpose and your aim from getting in contact with this situation. Your action, number 3 is the action, and in this you have to describe your action. What steps did you take? How did you manage the situation? What skills have you used? And in the result, you have to describe the outcomes and the lessons you learned from encountering this situation. The tip number 3 is that you have to be professional in the example you provide in your answer. So try not to use personal statements, try to be professional, and being professional, you have to put your patient interest first. You have to ensure the safety and the coherence of your team, and don't only put the example for your personal interest and to only reflect on yourself. Number 4, you have to be specific. So try to use examples from your real life examples from your daily living, and not to use generic or hypotheticals. And in number 5, it's really important to incorporate the core medical training competences in your answer. So it's important to look into the job description, review the requirements of the job you are applying to, and incorporate these values in your answer. And in number 6, you have to also incorporate the values of being a doctor in the UK. And these values are to provide patient-centered service, to work within a team, to use good communication with your patient and your team, and to use other ethical consideration as per the GMC guidance. The next point is you have to reflect on the lessons you learned from this encounter or this situation in the end of your answer. So try to show the interviewer what have you done good, what did you learn from the situation, and the lessons and how to use the lessons you learned from this situation in your future career as a trainee or as a doctor working with this interviewer. Next point is you have to find the sweet spot or the good balance between the level of detail in your answer and the conciseness of your answer. So be aware that the consultants are quite busy, and you have to give a very well-formed, concise answer in very short amount of time. And in order to achieve that, we will go to the next point, which is practice. It's really, really important to practice your answers. Try to use the STAR framework in answering the behavioral questions, and by doing that you will get the confidence of how to form your answers using the STAR framework and how to tell the stories that reflect your skills and your experience. Last thing is it's important to tailor your answers to match with the role you are applying to. So if you are applying to the role of an SHO or a clinical fellow, the answer would be a little bit different from when you apply to a registrar level. For example, when you apply to an SHO level, you have to always consider your limitations and try to incorporate the advice from your seniors, try to seek advice from your registrar. However, if you are a registrar, it's really important to focus more on your leadership skills. You have to involve your consultant when the situation gets to a certain degree of complexity. You have to incorporate the multidisciplinary team. So these are my tips for how to answer the behavioral question in the interview. And now I will go to explain an example of a behavioral question and how to answer it using the STAR framework. So let's imagine there is a question saying explain how you managed a difficult patient in your previous roles. So in order to answer this question, we will follow the STAR framework. So as a situation, you can say something like, during my previous role as a registrar in X hospital, I encountered a very anxious and difficult patient who refused to take their medications. And in the task, you can say, my task was to ensure that the patient receives a proper treatment and to address all their concerns. And in the action, you can say something like, I went to the patient and I spent a longer time to try to build rapport and to try to understand their concerns, listen to them. And then I explained the risks and the benefits of receiving the treatment. and I explained this information in a way that the patient can understand. And then I involved the multidisciplinary team. I tried to offer the patient some time to think about it. I offered the patient to, I asked the nurse in charge to come with me and to provide support to the patient during the discussion. I also offered the patient to invite a member of their family to support them during the discussion. Then we will, as a result, the level of the patient cooperation increased significantly. The patient agreed to stay and complete their treatment course. You have to reflect in the end of the answer saying, from this situation, I learned the importance of being empathetic with the patient, giving the time to communicate well with the patient, and in working in a multidisciplinary team to support my patient and find the balance between respecting the patient autonomy and providing them with the level of care they need. I hope you found this video quite useful, and if you like the video, please hit the like button and subscribe to my channel to keep updated on other videos that can help you navigate through your career and get to the job you dream of. Thank you for watching, and see you in the next video. Bye bye.